Hi, I am Dr. Prashant. I am psychiatrist and sexual medicine specialist. So today, on the occasion of World Sexual Health Day, I am going to throw some light on female sexual health, which I feel most ignored aspect of female. Because what I understand after seeing patients in my clinic, mostly the sexual health is more concentrated on males than females. So it is most of the people, they understand that it is only problem for male, not the female. So that's why it is most ignored part as far as female concern. So female sexual health, if we talk about, so there are different categories, different classifications of female sexual dysfunctions, but I don't want to go theoretically. Just in simple language, I want to put these categories and what are the main reasons and how it can be solved or treated. So in simple language, I'll try to explain here. So if we talk about female sexual dysfunction, so you would be wondering, almost 40% female, they undergo some point of time in their life with some or other kind of sexual dysfunction. So it is high percentage, 40% is huge. So if we talk about what are the problems, so that is classification of female sexual dysfunction. So if we talk about first problem, female may not get aroused, that is female may not respond to the whatever sexual stimulation they receive from the partner. So that is called as sexual arousal disorder. If I talk about second problem in female, that is sexual pain. In medical language, it is also called as dyspareunia, which may lead to again vaginismus. Third, female may not experience orgasm, that is orgasmic sexual dysfunction. And the last one is low libido, that is low desire, that is lack of desire, and also classified as, also termed as Hypoactive Sexual Desire Disorder. So these are the mainly four categories comes under the classification of female sexual dysfunction. So if you go back to the first classification or first problem, that is arousal disorder, as I said already, female will not get aroused, female will not get that pleasure, that sensation when partner try to stimulate. So ultimately the consequences, ultimately the sex will not go on, and ultimately either female will be frustrated or the partner will be frustrated. If we talk about the pain disorder, that is dyspareunia, so where actually the female, she experiences pain when partner tries to insert his genital. So this pain disorder may lead to vaginismus. Again, vaginismus means where the female contracts the muscles, the vaginal muscles. Here the pelvic floor or pelvic muscles are involved, which go into spasm, and female, when actual penetration is about to happen, female just contract the thighs or contract the vaginal muscles, and female just push the partner back. So ultimately, which leads to lack of penetration, or which leads to intercourse will not happen. So we see in our regular practice, that is unconsummated marriage, again which is very detailed topic, but unconsummated marriage means where the couple is married, however the penetration is not happen, and this goes on for years together. So people would be wondering, because I have seen patients or couples married for 17 years, but they had never the successful intercourse. So these are the regular cases which we see on daily basis. Around 3 to 4 couples we see just as an unconsummated marriage, but the number of years it varies, like 14 years, 10 years, 8 years, even 6 months, but yes, there is no penetration, no successful penetration happen. That's what it's called as unconsummated marriage because of vaginismus. And then next problem, if I talk about, that is the orgasmic disorder, where female doesn't experience orgasm during the sexual act. So if we talk about Indian population, so many female, they doesn't know what does the orgasm means, right? Because they never experience, and so no one question them also. The partners are not that close, or because of the male sexual dysfunction, female they don't get orgasm, and it's always blame to females only. So the male partner never asks whether really you got the orgasm or not. So again, there are different reasons and different consequences of this orgasmic disorder, but the overall, the female don't get orgasm in sexual act. And the last one is the desire disorder, that there is no libido. The female says that doctor, I don't have desire only, so how to initiate then? So these are all four classification comes under the female sexual dysfunctions, and basically these are all medical conditions, and the reasons could vary and could differ from like the psychological aspect till the biological aspect, right? Psychological briefly, in short, I would tell what could be the psychological reasons for these kind of problems. That is right from anxiety disorders, right, like general anxiety disorder, then major depressive disorder where the patient is diagnosed for depression, that leads to lack of desire. And then basically the relationship issues in the partner, husband, wife, there is no bonding, no emotional bonding, and that leads to lack of desire, obviously. And if we talk about the biological issues, so ultimately the hormonal disturbances, lot many hormones are involved here. Similarly, in male sexual dysfunction and female sexual dysfunction as well, lots of hormones involved, right? Right from testosterone. So we know that testosterone is a male hormone, however it is present in female as well. So it is not just male hormone, it is required in females also to get that desire, to get that sex drive. But many females may have this testosterone deficiency. But most important hormone in females, that is estrogen. So estrogen deficiency plays a very major role in all these kind of female sexual problems. So again, as age progresses, there would be hormonal disturbances, especially after 40 or 45, as female reaches their menopausal stage. Right, so these are the biological reasons, or physical reasons also we call it as. If we come back to the psychological aspect, so different anxiety disorders, already told you, even sometimes medications also causes the problems in desire or in orgasm, for that matter, right? If we talk about medication, what kind of medication, they impact the desire or orgasm or arousal as well. So sometimes antihypertensives. Sometimes we prescribe antidepressants to patients who are going through depression, but definitely these medications are important. But some of the antidepressants can impact the desire, can impact the arousal, can impact the orgasm, right? But it doesn't mean that patient should stop the antihypertensives, because definitely it is lifelong condition and patient has to take these antihypertensives for throughout their life. They should not stop the medication. Similarly, antidepressants also, whenever we prescribe, we know that sometimes it can cause, but however patient should not stop the medication until and unless they talk to the treating doctor, because there are certain medications which can be treated, which we can treat the depression as well as it will not cause the sexual side effects like the desire disorder or orgasmic disorder or arousal disorder. So patient should not stop the medication without discussing with doctors. Many times I have seen in my clinical practice, the patient, they speak to their friends and relatives, and simply they give some suggestions. Just you stop these medications, these are not going to work. In fact, you will be dependent on these kind of medications, and you just try yoga, or you just try just meditation. I really agree. I agree with the meditation and yoga, but that should be considered as add-on treatment, not as the primary treatment, because primary treatment would be, many times it is a pharmacological treatment. So instead of listening to the suggestions from friends and relatives and you stop medicine suddenly, so there are high chances that you would have relapse of depression, and which leads to again the sexual dysfunction. Both are interlinked to each other, because sexual dysfunction can lead to depression and depression can lead to sexual dysfunction. So instead of stopping medication without consulting with your treating doctor, and so don't do that, because definitely other remedies, other therapies are as a add-on treatment. So that's what I feel. So these are mainly, because if we talk about treatment, there are different treatment modalities available. So we discuss about the categories, we discuss about just in brief about the reasons, and the treatment part, as I said, definitely medical management, that are different medicines are available which may help you to improve in the desire level, which improves arousal also. And basically apart from that pharmacological treatment, other therapies like meditation, yoga therapy, the dietary habits also can improve your desire level. And most important, the relationship issues, which usually I see in my daily routine practice. Because everything is fine, but when there is no proper relationship between the couple, so definitely it impacts. Means male is capable of doing sex, even female is capable of doing sex, and both are capable of enjoying sex. But if there is no emotional connectivity, there is no emotional bonding, how the sex would happen? Because everything starts in brain, right? So the relationship issue is very important, because many times what happens, because of lack of the bonding, so if female has some issue, female will not express that problem to the male partner. So ultimately, if there is no talk between the couple, then how the partner would understand what she is going through? So what is important here is that there should be proper communication, the sexual communication. Apart from general regular routine communication, the sexual communication is also very important. If you don't talk to your partner, definitely your partner would not understand, and your partner would not think, or your partner would not support properly. So that's why this communication initiation is very important. Otherwise, female, they consider themselves as a culprit, or she is the only person who is responsible for whatever happening in between the couple. So that's why this talk, sexual communication is very, very important.